the disease model, right, of medicine says there's an organ, there's a defect in that organ, and then there are symptoms because of that defect, right? So in addiction, we have this broken brain, we have this broken pleasure sense caused by or exacerbated by high levels of stress and trauma, which result in loss of control, right? Loss of control is violating your core value system. I'm going to behave in a way totally contradictory to what I know is right. Loss of control, craving, right? That overwhelming, I need to feel different. And then persistent use despite negative consequences. If there are no negative consequences, there's really no reason to stop doing something. So if you continue to use a substance despite consequences, I would say there's a problem. And this is an interesting concept because problems could be in any realm, right? Social problems, so are your relationships being affected? Medical, are you having any physical problems because of this substance use? Social, so emotional, financial. I mean, there's all kinds of things that can be affected. If you're having a problem in any of those realms and continue to use, that's probably a problem. And I'll even say, like I say to people, you know, if a substance isn't a problem, then it shouldn't be a problem not to use it, right? So if a loved one says to you, hey, I'm worried about all of the alcohol you drink, and you continue to drink, well, then basically you're saying my drinking is more important to me than my relationship with you. How is that not a problem, right? Because if a loved one said to me, I'm worried about all the cookies you eat or the broccoli you eat or whatever, I'm probably going to at least be like, why would you be worried about that? I should probably take a look at it, right? But if I'm getting defensive, well, you don't understand, you're just whatever, then there's probably a problem. So addiction basically is broken brain, that's the organ, right? Specifically the midbrain and the cortex. Defect, which is downregulated dopamine receptors in the midbrain and lack of skill pathways in the cortex. Symptoms, loss of control, craving, persistent use despite negative consequences, right? So behavior, craving is physiological. So that's an actual physical symptom, craving. So yeah, it fits into the same exact disease model category as every other disease, right? Cancer, diabetes, same exact thing. There's a broken brain, it gets wacky, and then there's symptoms, right? Now, some of the symptoms, many of the symptoms are just things that we see behaviorally. That doesn't mean they're not symptoms of a broken brain, right? There are brain tumors that specifically only affect personality. So there are people who get a brain tumor, cancer, which we all know is, you know, a real disease, and their whole personality changes and they become difficult and mean and just terrible people, right? But then we have sympathy for them when we find out that they have a brain disease, that they have cancer. It doesn't excuse the fact that they're calling you names and they're really cruel. You still don't want to spend time with them, right? So I'm not excusing people with addiction from their behaviors. I'm not saying, oh, we have to forgive them and let them do whatever they need to do because they have this brain disease. No, I'm saying we have to understand and have compassion for the fact that they have a brain disease. They still can't act like jerks. I mean, that's not acceptable for anybody. But if we understand why they're acting that way, it makes it a little bit easier for us as family members or friends or society to swallow kind of what's happening, and also to think clearly as to how I might be able to help this person versus taking things personally and getting angry and defensive and reacting instead of acting.